This video, the beginning, where it started, can change your life and your professional career and all your investigations. It can give you an edge on any chiropractor in the land because most of them don't know how to do it. It can elevate a neurologist who's supposed to be great at locating these things and identify the source of the pain. The orthopedist the same way. With all the orthopedic tests, they do not find this information out. Chiropractors have built a whole profession on the wrong thing. Subluxations, discs are the thing. It's an electro-neurochemical machine. It's easy to do. It will change your life. It brought us up from looking at just nutrition to looking at the tough things of today, which are drug-resistant MRSA staph, tuberculosis, etc. If you can get past this, you're into a whole nother world. I suggest you take a good look at this video, and for the money, it'll change your life.
The subluxation concept has been the basis of chiropractic thought and treatment for nearly 100 years. There had been an acceptable amount of truth in this idea by early 20th century standards to carry the profession to qualified acceptance. With the development of the confirmatory challenge test and the BEV tests, it is asserted that the intervertebral disc lesion is the most fundamental biochemical model for 21st century chiropractic, osteopathy, naturopathy, and medicine. In the late 70s, Dr. Bryce E. Vickery of Redding, Connecticut, began to bridge the gap between tests available at that time and the presence of pain and malfunction in his patients. Dr. Vickery is a certified applied kinesiologist, a licensed chiropractic physician, the director of Connecticut Holistic Chiropractic Offices, and a member of the International College of Applied Kinesiology. Two major events occurred about 1964 that made this work possible. In England, J. Hounsfield invented the CAT scanner, and in the U.S., George Goodhart discovered applied kinesiology. Dr. Vickery pioneered the comparison studies of results using the confirmatory challenge test and hundreds of CAT scans, myelograms, and magnetic resonance imaging. Between 1982 and 1984, 1,219 cases were documented, and these cases had a total of over 2,000 intervertebral disc lesions. It was during this study that Dr. Vickery discovered the intradiscal lesion and discovered the true cause of back pain. Dr. Vickery is not alone in his assertions, for leading doctors from medicine support the same truth. The German orthopedist J. Kramer states, "Degenerative change in the intervertebral disc is the most common cause of back pain. A rupture within a disc with loosening of tissue without external protrusion is called an intradiscal rupture. These pains are primarily discogenic. A so-called secondary discogenic pain may arise from either the vertebral joints, subluxation, or the trunk muscles, trigger points." From a histological viewpoint, N. Bogduk, discussing the innervation of the lumbar discs, which included his own work and that of others, cites the presence of abundant nerve endings with various morphologies throughout the outer half of the annulus fibrosus, which are presumptive of multiple functions. These nerve endings are believed to have nociceptive, proprioceptive, and vasomotor functions. His conclusion, these observations demonstrate that the discs can be a primary source of low back pain. This pain arises from the annulus fibrosus itself and is transmitted by the nerves to the disc. It is in no way due to nerve root compression and can occur in the absence of frank disc rupture. Thermography was also utilized in a selected 10-case study involving auto accident and compensation cases. The discal effect on the peripheral nerves was verified in 9 cases when employed at the beginning of treatment. The 10th case was filmed after some weeks of treatment, and the pattern differences, while present, were insufficient for a positive diagnosis. This study involved 3 diplomates of thermography and was made possible by a grant to Dr. Vickery by Dr. Donald Koopman, president of MedTech Products Incorporated. Before proceeding with the CCT diagnosis and treatment of the IV disc lesion, there is important information that the treating doctors should know that is generally not available. Some of this information is an embarrassment to the chiropractic colleges. It should be. This graph, compiled from an unbiased survey which resulted in the book Backache Relief by Sobel and Klein, demonstrates that the applied kinesiologist by 1985 had surpassed all other methods in the treatment of serious low back pain. From right to left, these are neurologist, chiropractor, adjustment only, osteopath, general medical practitioner, orthopedist, chiropractor using modalities, acupuncturist, physiatrist using drugs, chiropractic applied kinesiologist. Even leading kinesiologists think in terms of single disc lesions. With the development of the BEV screen tests, which will be introduced in the next presentation, the findings of multiple disc lesions throughout the spine became the rule rather than the exception. In this comparison graph, the findings of Dr. Vickery's 1,219 and Dr. Kramer's 1,167 outpatient cases are equated. All cases were believed to be disc lesions. There is a similarity in appearance of the columns on the left, in which Dr. Vickery used mainly the CCT in the diagnosis, particularly in the cervical and lumbar areas. The introduction of the BEV tests led to the discovery of high incidence of thoracic disc lesions. Many of these are not recognized by the patient, but are verified by the CCT test. These are called silent disc lesions as far as pain symptoms, but are found to be affecting organs, heart, glands, thyroid, muscles everywhere, and acupuncture circuits, lung, heart, circulation, sex, and so on. The middle and most balanced graph by Dr. Vickery is believed to be the most accurate. The sinuvertebral nerve and its connections is redrawn after Kramer by Richard Heggie. In the 1987-88 seminars taught by Dr. Vickery, he found that so-called premier chiropractic colleges had not taught their recent graduates that there is nerve supply to the spinal discs. This is imperative in understanding the intradiscal lesion and its effects. Number one, the meningeal ramus or recurrent meningeal nerve. 2, the ventral ramus. 3, spinal ganglion with communicating rami. 4, dorsal ramus. 5, vertebral joint facets. 6, extensor muscle. 7, skin. Notice the sinuvertebral filaments entering the annulus fibrosus. Dr. Vickery will now demonstrate the confirmatory challenge test.